Some psychological illnesses can manifest as physical diseases, and modern psychiatric medicine will teach that the treatment for this is often going to be psychotherapy. Now, psychotherapy has existed basically for the past 100 years, but there's been a religious sacrament that has existed for nearly 2,000 years that may help with these diseases and maybe even better than what modern medicine can offer. I'm Dr. Anthony Kallistos. I'm a board-certified psychiatrist, and I spent years studying medical training and learning about the various medicines and psychotherapy techniques that can help with conditions such as depression, anxiety, post-traumatic stress disorder, mood disorder, and so much more. And there's a whole branch of medicine called Psychosomatic Medicine, in which psychological diseases can manifest as physical problems. For example, people may think they're having a heart attack, or may have symptoms of a stroke or symptoms of a seizure, maybe even have paralysis. And it's all because of this built up stress and tension in their mind and body that they haven't been able to effectively process. And so, as one might suspect, the treatment for these psychological conditions are going to be psychotherapy. And much of psychotherapy is just the patient talking with the clinician and the patient saying whatever is in their heart and their mind, their deepest thoughts and feelings. And the clinician will help them identify maybe any patterns of behavior, any patterns of thinking that may be causing some bad behaviors or causing distress. Maybe the clinician will help to identify any thoughts that are wrong or incorrect that could be causing anxiety or tension or something like that. Now, in the Orthodox faith, the Sacrament of Confession has been around, which has a lot of the same principles that one deals with in psychotherapy. Now, one of these concepts was touched upon by Metropolitan Kallistos Ware in his book, Sacraments of Healing, where he says that the process of bringing into the open what is hidden is decisive behind spiritual counsel. That, of course, is also the principle in modern psychotherapy, but the Desert Fathers thought of it before Freud and Jung. So Freud and Jung were people that lived in the late 19th century, early 20th century, that really helped to start the psychotherapy movement. And the Desert Fathers are these monks that lived in the wilderness, namely the Egyptian desert, to help fight off the distractions of the world and focus on their spiritual life and get close to God. And so many people would go travel to these monks and hear their spiritual wisdom or spiritual counsel. And so what this Metropolitan Bishop Kallistos Ware is saying is that the Desert Fathers basically were having similar effects at what modern psychotherapy was trying to do or is trying to do. And the same author also reveals that the process of revealing these things is important because the more a person conceals his thoughts, the more they multiply and gain strength. But an evil thought, when revealed, is immediately destroyed. So what's a little bit different than confession versus therapy is that in confession, people are going to more reveal some of the evil or some of the dark thoughts that they have, some of the things that they want to change, their bad habits. Psychotherapy may or may not be like that. A lot of psychotherapy might be people sort of blaming others or blaming their boss or their spouse or something along those lines. Whereas a lot of the focus in confession is someone blaming themselves and trying to focus on themselves, what they need to do to learn and grow. So the author further states that if you hide things, they have great power over you. But if you could only speak of them before God in the presence of another, then they will often wither away and lose their power. We can see the importance in this church sacrament of revealing what is in our inner thoughts and feelings. And by revealing these things, they're not going to take over our lives. It's important to note that not all priests are able to give the sacrament of confession. They have to be particularly trained and ready to give this, just like therapists or mental health clinicians have to be trained before they do psychotherapy. So why do I think that confession is preferred over psychotherapy? We know from the Bible that sin can be the cause of some illnesses. As in the case of the sick man in Bethsaida, where it says that afterward Jesus found him in the temple and said to him, "See, you have been made well. Sin no more, lest the worst things come upon you." Bishop Youanis, in his book, The Paradise of the Spirit, says that confession is not only a psychological treatment, it is an important church sacrament, and psychological treatment is one of its advantages. Forgiveness of sins accompanies the sacrament. So a sacrament is something that's mysterious, and it can help to make room for God, because God, we cannot fully know him. He's incomprehensible. So man always tries to learn more and more about God, but can't fully know God. But in these sacraments, we know that God is working somehow. So psychotherapy is not a sacrament. It's just going to be a healing process. But confession can be both a healing process and a sacrament. So where God can really work through the confession experience. Whereas in a psychotherapy experience, even if the psychotherapist is the most spiritual, wise person, that sacrament will not be present. Now, in many cases, change takes time. This is both true of confession and psychotherapy. But again, the grace of God is more likely to intervene with the sacrament of confession than it is with psychotherapy. And because so many illnesses and so many diseases are from psychological problems, and psychotherapy has its limitations, I think it's incredibly important that people do their part into partaking in this sacrament to try and help with health and healing.